Mounjaro, tirzepatide injection, the mechanism behind the peptide. Indication: Mounjaro is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus. Limitations of use: Mounjaro has not been studied in patients with a history of pancreatitis. Mounjaro is not indicated for use in patients with type 1 diabetes mellitus. Please see important safety information contained within this video and full prescribing information, including boxed warning about possible thyroid tumors, including thyroid cancer, and medication guide at mounjaro.com/risk. The incretin effect. Glucose-dependent insulinotropic polypeptide, or GIP, and glucagon-like peptide 1, or GLP-1, are incretins that are released in response to nutrient uptake in the gut. GIP and GLP-1 enhance postprandial insulin release from the pancreas and are responsible for the incretin effect. The incretin effect refers to the phenomenon in which oral glucose elicits a greater stimulation of insulin secretion than infused glucose when the same plasma glucose levels are achieved. In healthy humans, the incretin effect is responsible for up to 70% of postprandial insulin. Both GIP and GLP-1 drive the incretin effect. However, GIP is responsible for approximately 2/3 of the total effect in healthy humans. In individuals with type 2 diabetes, the incretin effect is impaired, contributing to insufficient control of postprandial glucose levels. Mounjaro, a single peptide that activates GIP and GLP-1 receptors. Mounjaro is the first in a new class for the treatment of type 2 diabetes. It is a single peptide that activates GIP and GLP-1 receptors in the body. The amino acid sequence of Mounjaro is engineered from native human GIP. The modified structure enables Mounjaro to also bind to the GLP-1 receptor and allows for once-weekly dosing. The activity of Mounjaro on the GLP-1 receptor is lower than the activity of the native GLP-1 hormone, but on the GIP receptor, the activity of Mounjaro is similar to the native GIP hormone. In individuals with type 2 diabetes, Mounjaro improves glycemic control through several mechanisms. Mounjaro enhances both first and second phase insulin secretion, as well as reduces glucagon levels. Mounjaro also improves insulin sensitivity. Lastly, Mounjaro decreases food intake and slows gastric emptying. The delay is largest after the first dose, and this effect diminishes over time. Ultimately, Mounjaro triggers metabolic actions exerted by two incretin hormones to improve glycemic control in adults with type 2 diabetes mellitus as an adjunct to diet and exercise. Mounjaro is the first in a new class for the treatment of type 2 diabetes. Mounjaro is a single peptide that activates GIP and GLP-1 receptors in the body. Mounjaro enhances both first and second phase insulin secretion, reduces glucagon levels, improves insulin sensitivity, decreases food intake, and slows gastric emptying. Important safety information for Mounjaro: tirzepatide. Warning: risk of thyroid C-cell tumors. In both male and female rats, tirzepatide causes dose-dependent and treatment duration-dependent thyroid C-cell tumors at clinically relevant exposures. It is unknown whether Mounjaro causes thyroid C-cell tumors, including medullary thyroid carcinoma, MTC, in humans, as human relevance of tirzepatide-induced rodent thyroid C-cell tumors has not been determined. Mounjaro is contraindicated in patients with a personal or family history of MTC or in patients with multiple endocrine neoplasia syndrome type 2, MEN2. Counsel patients regarding the potential risk for MTC with the use of Mounjaro and inform them of symptoms of thyroid tumors, for example, a mass in the neck, dysphagia, dyspnea, persistent hoarseness. Routine monitoring of serum calcitonin or using thyroid ultrasound is of uncertain value for early detection of MTC in patients treated with Mounjaro. Mounjaro is contraindicated in patients with a personal or family history of MTC, or in patients with MEN2, and in patients with known serious hypersensitivity to tirzepatide or any of the excipients in Mounjaro. Risk of thyroid C-cell tumors. Counsel patients regarding the potential risk for MTC with the use of Mounjaro and inform them of symptoms of thyroid tumors, for example, a mass in the neck, dysphagia, dyspnea, persistent hoarseness. Routine monitoring of serum calcitonin or using thyroid ultrasound is of uncertain value for early detection of MTC in patients treated with Mounjaro. Such monitoring may increase the risk of unnecessary procedures due to the low test specificity for serum calcitonin and a high background incidence of thyroid disease. Significantly elevated serum calcitonin values may indicate MTC, and patients with MTC usually have calcitonin values greater than 50 nanograms per liter. If serum calcitonin is measured and found to be elevated, the patient should be further evaluated. Patients with thyroid nodules noted on physical examination or neck imaging should also be further evaluated. Pancreatitis. Acute pancreatitis, including fatal and non-fatal hemorrhagic or necrotizing pancreatitis, has been observed in patients treated with GLP-1 receptor agonists. Pancreatitis has been reported in Mounjaro clinical trials. Mounjaro has not been studied in patients with a prior history of pancreatitis. It is unknown if patients with a history of pancreatitis are at higher risk for development of pancreatitis on Mounjaro. Observe patients for signs and symptoms, including persistent severe abdominal pain, sometimes radiating to the back, which may or may not be accompanied by vomiting. If pancreatitis is suspected, discontinue Mounjaro and initiate appropriate management. Hypoglycemia with concomitant use of insulin secretagogues or insulin. Concomitant use with an insulin secretagogue, for example, sulfonylurea, or insulin, may increase the risk of hypoglycemia, including severe hypoglycemia. The risk of hypoglycemia may be lowered by reducing the dose of sulfonylurea or other concomitantly administered insulin secretagogue, or insulin. Inform patients using these concomitant medications of the risk of hypoglycemia and educate them on the signs and symptoms of hypoglycemia. Hypersensitivity reactions. Hypersensitivity reactions, sometimes severe, have been reported with Mounjaro in clinical trials. If hypersensitivity reactions occur, discontinue use of Mounjaro, treat promptly per standard of care, and monitor until signs and symptoms resolve. Do not use in patients with a previous serious hypersensitivity to Mounjaro. Use caution in patients with a history of angioedema or anaphylaxis with a GLP-1 receptor agonist because it is unknown if such patients will be predisposed to these reactions with Mounjaro. Acute kidney injury. Mounjaro has been associated with gastrointestinal adverse reactions, which include nausea, vomiting, and diarrhea. These events may lead to dehydration, which, if severe, could cause acute kidney injury. In patients treated with GLP-1 receptor agonists, there have been post-marketing reports of acute kidney injury and worsening of chronic renal failure, sometimes requiring hemodialysis. Some of these events have been reported in patients without known underlying renal disease. A majority of reported events occurred in patients who had experienced nausea, vomiting, diarrhea, or dehydration. Monitor renal function when initiating or escalating doses of Mounjaro in patients with renal impairment, reporting severe adverse gastrointestinal reactions. Severe gastrointestinal disease. Use of Mounjaro has been associated with gastrointestinal adverse reactions, sometimes severe. Mounjaro has not been studied in patients with severe gastrointestinal disease, including severe gastroparesis, and is therefore not recommended in these patients. Diabetic retinopathy complications in patients with a history of diabetic retinopathy. Rapid improvement in glucose control has been associated with a temporary worsening of diabetic retinopathy. Mounjaro has not been studied in patients with non-proliferative diabetic retinopathy requiring acute therapy, proliferative diabetic retinopathy, or diabetic macular edema. Patients with a history of diabetic retinopathy should be monitored for progression of diabetic retinopathy. Acute gallbladder disease. In clinical trials, acute gallbladder disease was reported by 0.6% of Mounjaro-treated patients and 0% of placebo-treated patients. If cholelithiasis is suspected, gallbladder diagnostic studies and appropriate clinical follow-up are indicated. The most common adverse reactions reported in greater than or equal to 5% of Mounjaro-treated patients in placebo-controlled trials were nausea, diarrhea, decreased appetite, vomiting, constipation, dyspepsia, and abdominal pain. Drug interactions. When initiating Mounjaro, consider reducing the dose of concomitantly administered insulin secretagogues, such as sulfonylureas, or insulin, to reduce the risk of hypoglycemia. Mounjaro delays gastric emptying and thereby has the potential to impact the absorption of concomitantly administered oral medications, so caution should be exercised. Pregnancy. Limited data on Mounjaro use in pregnant women are available to inform on drug-associated risk for major birth defects, miscarriage, or other adverse maternal or fetal outcomes. Based on animal reproduction studies, there may be risks to the fetus from exposure to tirzepatide. Use only if potential benefit justifies the potential risk to the fetus. Lactation. There are no data on the presence of tirzepatide in human milk, the effects on the breastfed infant, or the effects on milk production. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for Mounjaro and any potential adverse effects on the breastfed infant from Mounjaro or from the underlying maternal condition. Females of reproductive potential. Advise females using oral hormonal contraceptives to switch to a non-oral contraceptive method or add a barrier method of contraception for 4 weeks after initiation and for 4 weeks after each dose escalation. Pediatric use. Safety and effectiveness of Mounjaro have not been established, and use is not recommended in patients less than 18 years of age. Please see accompanying prescribing information, including boxed warning about possible thyroid tumors, including thyroid cancer, and medication guide available on the website. Please see instructions for use included with the pen.